Epilepsy. The best treatment options: temporary confusion, staring spell, psychic symptoms, uncontrollable jerking, loss of consciousness. Epilepsy is a central nervous system disorder, neurological disorder, in which nerve cell activity in the brain becomes disrupted, causing seizures or periods of unusual behavior, sensations, and sometimes loss of consciousness. Seizure symptoms can vary widely. Some people with epilepsy simply stare blankly for a few seconds during a seizure, while others repeatedly twitch their arms or legs. About 1 in 26 people in the United States will develop a seizure disorder. Nearly 10% of individuals may have a single unprovoked seizure. However, a single seizure doesn't mean you have epilepsy. At least 2 unprovoked seizures are generally required for an epilepsy diagnosis. Even mild seizures may require treatment because they can be dangerous during activities such as driving or swimming. Treatment with medications or sometimes surgery can control seizures for about 80% of people with epilepsy. Some children with epilepsy may also outgrow their condition with age. Symptoms: because epilepsy is caused by abnormal activity in brain cells, seizures can affect any process your brain coordinates. Seizure signs and symptoms may include temporary confusion, a staring spell, uncontrollable jerking movements of the arms and legs, loss of consciousness or awareness. Psychic symptoms. Symptoms vary depending on the type of seizure. In most cases, a person with epilepsy will tend to have the same type of seizure each time, so the symptoms will be similar from episode to episode. Doctors generally classify seizures as either focal or generalized, based on how the abnormal brain activity begins. Focal seizures. When seizures appear to result from abnormal activity in just one area of your brain, they're called focal, partial, seizures. These seizures fall into 2 categories. Focal seizures without loss of consciousness, simple partial seizures. These seizures don't cause a loss of consciousness. They may alter emotions or change the way things look, smell, feel, taste, or sound. They may also result in involuntary jerking of a body part, such as an arm or leg, and spontaneous sensory symptoms such as tingling, dizziness, and flashing lights. Focal dyscognitive seizures, complex partial seizures. These seizures involve a change or loss of consciousness or awareness. During a complex partial seizure, you may stare into space and not respond normally to your environment or perform repetitive movements, such as hand rubbing, chewing, swallowing, or walking in circles. Symptoms of focal seizures may be confused with other neurological disorders, such as migraine, narcolepsy, or mental illness. A thorough examination and testing are needed to distinguish epilepsy from other disorders. Generalized seizures. Seizures that appear to involve all areas of the brain are called generalized seizures. 6 types of generalized seizures exist. Absence seizures. Absence seizures, previously known as petit mal seizures, often occur in children and are characterized by staring into space or subtle body movements such as eye blinking or lip smacking. These seizures may occur in clusters and cause a brief loss of awareness. Tonic seizures. Tonic seizures cause stiffening of your muscles. These seizures usually affect muscles in your back, arms, and legs and may cause you to fall to the ground. Atonic seizures. Atonic seizures, also known as drop seizures, cause a loss of muscle control, which may cause you to suddenly collapse or fall down. Clonic seizures. Clonic seizures are associated with repeated or rhythmic, jerking muscle movements. These seizures usually affect the neck, face, and arms. Myoclonic seizures. Myoclonic seizures usually appear as sudden brief jerks or twitches of your arms and legs. Tonic-clonic seizures. Tonic-clonic seizures, previously known as grand mal seizures, are the most dramatic type of epileptic seizure and can cause an abrupt loss of consciousness, body stiffening and shaking, and sometimes loss of bladder control or biting your tongue. Causes. Epilepsy has no identifiable cause in about half of those with the condition. In the other, the condition may be traced to various factors. Genetic influence. Some types of epilepsy, which are categorized by the type of seizure you experience or the part of the brain that is affected, run in families. In these cases, it's likely that there's a genetic influence. Researchers have linked some types of epilepsy to specific genes, though it's estimated that up to 500 genes could be tied to the condition. For most people, genes are only part of the cause of epilepsy. Certain genes may make a person more sensitive to environmental conditions that trigger seizures. Head trauma. Head trauma as a result of a car accident or other traumatic injury can cause epilepsy. Brain conditions. Brain conditions that cause damage to the brain, such as brain tumors or strokes, can cause epilepsy. Stroke is a leading cause of epilepsy in adults older than age 35. Infectious diseases. Infectious diseases, such as meningitis, AIDS and viral encephalitis, can cause epilepsy. Prenatal injury. Before birth, babies are sensitive to brain damage that could be caused by several factors, such as an infection in the mother, poor nutrition or oxygen deficiencies. This brain damage can result in epilepsy or cerebral palsy. Developmental disorders. Epilepsy can sometimes be associated with developmental disorders, such as autism and neurofibromatosis. Risk factors. Certain factors may increase your risk of epilepsy. Age. Family history. Head injuries. Stroke and other vascular diseases. Dementia. Brain infections. Seizures in childhood. Diagnosis. Pediatric epilepsy consultation. To diagnose your condition, your doctor will review your symptoms and medical history. Your doctor may order several tests to diagnose epilepsy and determine the cause of seizures. Neurological examination. Your doctor may test your behavior, motor abilities, mental function and other areas to diagnose your condition and determine the type of epilepsy you may have. Blood tests. Your doctor may take a blood sample to check for signs of infections, genetic conditions or other conditions that may be associated with seizures. Electroencephalogram, EEG. This is the most common test used to diagnose epilepsy. In this test, doctors attach electrodes to your scalp with a paste-like substance. Computerized tomography, CT, scan. A CT scan uses X-rays to obtain cross-sectional images of your brain. Magnetic resonance imaging, MRI. An MRI uses powerful magnets and radio waves to create a detailed view of your brain. Functional MRI, fMRI. A functional MRI measures the changes in blood flow that occur when specific parts of your brain are working. Positron emission tomography, PET. PET scans use a small amount of low-dose radioactive material that's injected into a vein to help visualize active areas of the brain and detect abnormalities. Single photon emission computerized tomography, SPECT. This type of test is used primarily if you've had an MRI and that didn't pinpoint the location in your brain where the seizures are originating. Neuropsychological tests. In these tests, doctors assess your thinking, memory and speech skills. The test results help doctors determine which areas of your brain are affected. Treatment. Medication. Most people with epilepsy can become seizure-free by taking one anti-seizure medication, called anti-epileptic medication. Others may be able to decrease the frequency and intensity of their seizures by taking a combination of medications. Your doctor will advise you about the appropriate time to stop taking medications. Anti-seizure medications may have some side effects. Mild side effects include fatigue, dizziness, weight gain, loss of bone density, skin rashes, loss of coordination, speech problems, memory and thinking problems. More severe but rare side effects include depression, suicidal thoughts and behaviors, severe rash, inflammation of certain organs, such as your liver, Surgery. Epilepsy surgery. Surgery is most commonly done when tests show that your seizures originate in a small, well-defined area of your brain that doesn't interfere with vital functions such as speech, language, motor function, vision or hearing. In surgery, your doctor removes the area of your brain that's causing the seizures. Therapies. Vagus nerve stimulation. In vagus nerve stimulation, doctors implant a device called a vagus nerve stimulator underneath the skin of your chest, similar to a heart pacemaker. Ketogenic diet. Some children with epilepsy have been able to reduce their seizures by following a strict diet that's high in fats and low in carbohydrates. Pacemaker for epilepsy. In addition, new minimally invasive surgical techniques, such as MRI-guided laser ablation, show promise at reducing seizures with fewer risks than traditional open brain surgery for epilepsy.